Bismillah ar-Rahman ar-Rahim. My name is Ahmad Ashraf Abdulaziz. Today I'm going to talk about laparoscopic total hysterectomy, and this is one of the most commonly performed minimally invasive gynecologic procedure, and it involves removing the uterus using laparoscopy. For the definition, a laparoscopic total hysterectomy is a minimally invasive surgery where we remove the entire uterus through 3 to 4 small incisions in the abdomen. Sometimes we also remove the cervix, and depending on the case, we may also remove the tube or ovaries. This technique usually gives a better recovery and less pain compared to the open surgery. For the indication, it's indicated in several conditions such as symptomatic uterine fibroid, abnormal uterine bleeding that doesn't respond to medical treatment, adenomyosis, endometrial hyperplasia, or early cancer, or chronic pelvic pain, and selected cases of uterine prolapse. This procedure have absolute and relative contraindication. Absolute contraindication include hemodynamic instability or uncorrected coagulopathy, and relative contraindication include very large uterus and severe pelvic adhesion from previous surgeries or infection, and advanced malignancies that require open surgery. Before the surgery, we should do a full history and physical examination, and we perform a pelvic ultrasound, and sometimes we do MRI. We request a laboratory test such as complete blood count and coagulation profile, and the patient must receive a proper counseling and sign informed consent. Thromboprophylaxis is usually given, and bowel preparation may be done depending on the center. The needed instrument for this procedure include a high definition laparoscope and the camera system, 3 or 4 trocars, energy devices such as harmonic or ligature, a uterine manipulator, and a suction irrigation device. The procedure starts with creating a pneumoperitoneum, then we place the port under the direct vision, and then we inspect the pelvis and the abdomen, and then coagulate and divide the round ligament, and finally develop the bladder flap. Next, we identify and ligate the uterine arteries, and we divide the cardinal and uterosacral ligaments, then perform a circumferential colpotomy around the cervix, and the uterus is removed either vaginally or by morcellation if it's large. At the end, we close the vaginal cuff laparoscopically. And this procedure have intraoperative complication and extraoperative complication. The intraoperative complication may include bleeding, bladder or ureteric injury, bowel injury, or conversion to open surgery. The postoperative complication include infection, thromboembolism, and vaginal cuff dehiscence. After surgery, early ambulation is important to prevent the DVT. We ensure adequate pain control, gradually resume diet, and take care of the port sites. The patient should avoid sexual intercourse and heavy lifting for about 6 weeks, and follow-up is usually scheduled after 1 to 2 weeks. At the end, the conclusion is laparoscopic total hysterectomy is safe and effective, minimally invasive technique that offer faster recovery, less pain, and a shorter hospital stay compared to open surgery. Thank you.